How's it going, folks? My name is Gilbert Salinas, and today we're going to be going over a brief overview over the Association of Diabetic Care and Education Specialists 7 self-care behaviors. Now, these are not on any particular order, and they'll be as followed. We're going to be going over healthy eating, being active, taking medications, self-monitoring, problem solving, healthy coping, and reducing risk. Now, when it comes to healthy eating, simply put, it's eating whole foods such as lean proteins, fruits, and vegetables. According to the American Diabetic Association, your plate should be half vegetables. So half the plate should be vegetables, and all vegetables are free game. A quarter of the plate should be lean protein, and another quarter should be a carbohydrate. And some examples of lean proteins are fish, turkey, chicken, beef, and pork. Of course, that's not limited to, these are just the easiest ones to kind of remember. Vegetables, like I said, are free game. So salads, broccoli, cucumber, green beans, and a good rule of thumb to remember is the more color that they all have, the more nutrients you will intake as far as vitamins and antioxidants. And then lastly, carbohydrates, and we're talking about rice, pasta, potatoes, and beans. Unfortunately, it's all the good stuff, right? So the number one question I get asked as a diabetes educator is, what can I eat? And the number one question I ask in return is, how often do you check your blood sugar? This is so important because it tells us how our bodies respond to the foods that we eat. And the truth is that diabetics can eat like anyone else, but the key is figuring out how much we can have at one sitting. I happen to know that in my case, 60 grams of carbohydrates is my limit based on my activity level that my body can tolerate before my glucose goes higher than my goal of keeping my glucose less than 140. Okay. Next, we're going to be talking about self-monitoring. And real quick, if you're on pill medications, it's recommended to check your blood glucose 1 to 3 times per day. All right. If you're on insulin, you want to check it a little bit more, so about 3 to 5 times a day. Your glucose goals is checking your sugar first thing in the morning. That's going to be your fasting. You want to keep that between 80 and 130. 2 hours after you eat, less than 180, and trying to keep your A1C less than 7%. The more numbers that you give your provider, the easier it will be for them to determine on how to adjust your medication. So just remember the correlation between your glucose values and the foods that we eat. Being active and reducing risk kind of go hand in hand. Being active is just not about losing weight. It has many health benefits like lowering blood cholesterol, improving blood pressure, lowering stress, anxiety, and improving mood, all of which reduce the risk of the diabetic's 2 worst enemies, which are heart attacks and strokes. The CDC recommends shooting for 150 minutes of physical activity per week, which equates to 20 to 30 minutes a day, which can be further broken down into multiple 10-minute sessions. Now, I know you're not going to go right to 150 minutes. Start as slow and as comfortable as you can. Start off with 5 minutes and kind of increase it as time goes on, as you feel stronger. Some examples of aerobic exercise can be walking, jogging, riding a bicycle, and then that can also include resistance training such as lifting weights or using resistance bands. Remember, consult with your primary care physician before starting any type of physical activity. Studies show that a 5 to 10% reduction in body weight can lower your A1C by half a point. In fact, being active in and of itself can lead to improved glycemic control, which in the long term reduces risk of vision loss, kidney problems, neuropathy, decreased wound healing, or uncontrolled blood pressure. Now we're going to talk about medications. Now, I know I don't expect you to know all the medications. There's so many out there. Just remember the name, the dose, and when to take the medication. You want to be consistent with the medications. You also want to be vigilant when it comes to recording your blood glucose levels. Your overall goal should be to go down to the lowest doses possible or to come off insulin or pill medications altogether. Problem solving. Learning and overcoming obstacles such as hypoglycemia, hyperglycemia, and sick day management. Hypoglycemia signs and symptoms are shaking, trembling, weakness, sweaty, clammy skin, and or headache. Of course, this is not limited to. And to treat that, we like to use the 15 and 15 rule. So taking 15 grams of carbohydrates and rechecking your blood glucose in 15 minutes. Remember, make sure that your overall goal is to get your blood glucose less than 180 or treat yourself until the symptoms subside. Some examples are 4 ounces of fruit juice or soda, 3 to 4 pieces of hard candy, 5 to 6 lifesavers, and 8 to 10 gummy bears, to name a few. Hyperglycemia signs and symptoms are frequent urination, increased thirst, blurred vision, excessive hunger. And to treat that, you want to minimize your carbohydrate intake and drink plenty of non-sugary fluids and increase your activity level. Sick day management. When times when you're not feeling well, you feel like an infection's coming on, number one thing is to stay hydrated, especially when the onset of nausea and vomiting occurs. You want to check your glucose more often, so approximately every 2 to 4 hours. If you're on insulin and you have readings greater than 300 for more than 2 consecutive readings, or you're unable to get your glucose less than 250 despite treatment, call your primary care physician or seek immediate medical attention, as this can lead to a life-threatening condition called diabetic ketoacidosis. And lastly, healthy coping. Stress management, proper coping skills, having a good support system, having good communication with a primary care physician. Some examples are participating in faith-based activities, finding a hobby, meditation, exercise, or listening to something positive. All in all, you want to try to the best of your ability to keep a positive mental attitude. I know it's easier said than done. Diabetes is not easy, but it is as hard as we make it. And the last thing I want to drive home is this is not your fault, okay? Some of us are either predisposed or at increased risk for diabetes. The one thing we can't change is our genes. I know that's a real quick overview. I hope you found value. And if you do want to contact me and ask any questions related to diabetes, you can find me on Facebook at Team Teddy, and that's TEDDE Diabetes Support Group. Just ask to join the page. I'll let you on, and you can ask me any questions on the Facebook Messenger, and I'll be happy to help you out the best that I can. Well, I'm going to wrap this up. Y'all have a great day, and enjoy yourselves.